from the NBC 15 studios, a town hall meeting. Tonight's discussion, the opioid crisis.
Because somebody decided to lace that drug with fentanyl.
His son was a healthy 26-year-old. Cause of death, fentanyl. The epidemic in this country continues to grow.
And it's not the needles in the arms under the bridges, it's people that are taking pills that they're getting off the street or prescriptions. They're mixing it with benzodiazepines like Xanax and Ativan. They have a couple drinks and they don't wake up the next morning.
Getting rid of that stereotype and that stigma behind seeking treatment, makes a huge difference.
In 2017, more than 70,000 people in the U.S. didn't wake up. Nearly 3/4 involved a prescription or illicit opioid. 130 Americans dead every day from these killers. According to the CDC, Alabama has seen a significant increase in drug overdose deaths.
One day, I caught him in my bathroom shooting up opiates with a needle with duct tape on it. And I thought to myself, I can't do this anymore. I can't watch him die in my house.
Hi, and good evening, everybody. I'm NBC 15's Greg Peterson. Those are the faces of opioid addiction. Over the next hour, we're going to focus on identifying the issues, talking to those in the trenches, and finding solutions as we fight this crippling health crisis. Tonight, I'll be taking questions from you on our NBC 15 Facebook and Twitter pages. Post them, and we'll get them answered live during tonight's discussion. Right now, let's send it over to my co-anchor, Kim Anderson, who is standing by in our studio with our panel. Kim?
All right, Greg, thank you. And thank you for joining us tonight for this very important NBC 15, Your Voice, Your Future panel discussion on the opioid crisis. Now, we've invited several experts to take part on this panel tonight. They are from different backgrounds and each have a wealth of knowledge and experience about dealing with opioid addiction. The views they express are their own unless they state otherwise. Joining us tonight, we have Ms. Virginia Guy, who is the director of the Drug Education Council right here in Mobile. Brian Sullivan, who is Director of Public Relations for Addiction Campuses, a drug and alcohol rehab program with locations across the country. Also with us tonight, Haley Beeson, a former addict who now runs a recovery home for women in Baldwin County, and Dr. John McMahon Jr., the Medical Director for Mobile Fire Rescue. I want to thank you all so much for being here with us tonight. Now, we want to begin this evening with some numbers first, the cold hard facts about opioid addiction and why this epidemic is truly a national crisis. 68% of all overdose deaths in the country involve an opioid. Now, about 130 Americans die every day from an opioid overdose. We did the math. That means 5 people will die during the course of this discussion. Now, when it comes to overdosing, there are no boundaries when it comes to age, race, gender, or income. This is truly a public health emergency, as the president has declared. Now, I wanted to start our discussion with one sobering number here, 400,000. That's how many people died from an opioid overdose from 1999 to 2017. That is nearly the entire population of Mobile County. So I want to ask tonight, what caused the opioid epidemic to become so widespread? And that's what we're going to begin. First is, what started this? Let's start with you, Dr. McMahon.
It seems to be that right around the turn of the century, pain became the 5th vital sign, and we were encouraged to treat pain aggressively to get the patient to be more comfortable. And in doing this, we were somewhat mandated by the Joint Commission as well as Medicare to make sure that pain was addressed, and it did become a 5th vital sign so that patients were given medications either orally by intramuscular injection or IV to relieve their pain as quickly as possible. And over time, prescription narcotics then became an issue that has ballooned, where that's where most of the issues are now today.
So were these narcotics always there? They just weren't prescribed as much?
That's correct.
Okay, now Virginia, let's talk about when we started noticing this was a problem. When did the red flag raise?
Right. Well, when we started seeing, behind all of these numbers that you just gave are real people. And all of these people have families and people who love them. And so when we saw these people, particularly these younger people, you know, dying of these overdose deaths, it became very alarming, you know, and that's when we started looking as a community about what can we do about this. You know, we've got to stop we've got to stop this opioid epidemic.
And you mentioned it, opioid, there's faces behind the medicine,
Right.
behind the numbers, behind the statistics. Haley, you are one of those faces.
Yeah.
You have a very interesting story here. Tell us about when you became addicted to opioid.
When I was 14 years old, I was in a major car accident, went through the windshield. I was at the hospital that day, and I remember being given prescription pain medication, and instantly I became an addict. I loved the feeling so much. It was like my mind said, okay, Haley, now you can do life. And whatever you need to do to keep getting these pills, you need to do. And I then got in another car accident. I was never the driver, it just kept happening to me. So it was always another surgery or another accident that just kept leading to the medication. From the time of 14 until I got sober at 29, I don't think I went without prescription pain medication.
So you're talking about 15 years, all through your high school years. Did no one notice?
No, because I kept getting in accidents. And back then, I don't think there was so much awareness on it, and it was just what I was being prescribed by the doctor. My addiction didn't spiral out of control till my late 20s to where I was getting in trouble and having consequences. I was just taking my prescription pain medication that I was given.
And you like that prescription. Now, Brian, you sit there and you work with addicts to try to get them off. Let's touch on that real quick. How difficult, I mean, for a lot of people don't really know the struggle and they can't understand, you know, they think it's so easy. It's just go and get some treatment and you can be done, you can be cured.
You know, it's not, nobody wakes up one day and says, I want to be addicted to opioids. Nobody. It's not something that people choose to do. You know, we had that Dr. McMahon was talking about with the opioids, the fifth vital sign, becoming the fifth vital sign. There's also an attitude in our culture where no amount of pain whatsoever is acceptable. And so people think, well, the doctor gave this to me, so it's okay if I take 1 or 7 of them. And people were taking the pills not as directed. And then when they were not able to go back and get that supply, sometimes they would turn to illicit means to get those pills. So it just spiraled into a perfect storm. And they call it the silent killer because there wasn't a big sense of urgency. Really, you know, when you think about the numbers, it's equivalent to 3 jetliners crashing to the ground a week. If that were happening, then flights would be grounded until we got to the bottom of what was causing it. But it's killing our youth and our people silently. And so not a lot of people know it. So things like this, where we're coming on, we're talking about it, we're having a discussion about it, that really helps.
Now, Hallie mentioned something that was very interesting. She said she knew instantly she was addicted. Is there something that makes somebody more likely to become an addict? There's something in the brain that's like, you know, hey, more so than somebody else.
We have a number of things that contribute to it, including environment, the environment that you're in. If you're in a safe space to use with people who find that acceptable, who are not interested, you know, in getting you help really, then it can also perpetuate that addiction. It can fast track it where, you know, you begin to use more and you're more comfortable using and spiral into addiction a lot easier. There are some things that some preventative methods that you can put into place to try to ensure that you don't and have people in your life that hold you accountable. So yes, there are a number of contributing factors that could help progress an addiction.
I have been taught that the 5 things, and Dr. McMahon can tell us more, is a severe blow to the head, a grand mal seizure, a very high fever for several days, predisposition genetics, and one more that I can't remember off the top of my head. But it's always stuck with me about the severe blow to the head with me in that accident that day I went out the windshield. And so I don't know if, and I'm talking about for the brain to become addicted.
To make you more likely to become addicted.
Yeah.
It only takes 5 to 7 days of taking oxycodone on a regular basis before somebody's metabolism will then require it to be continually replaced.
Really? So anyone can become addicted, even if you
That
think,
is
you know
correct.
what, that's not me. That's nothing that's going to happen to me. It can happen to you.
Yes.
Because we've seen stay-at-home moms. Virginia, I'm sure you can answer this. Working class people, it's not just people you think that are drug addicts that are walking the streets or crazy teenagers.
Right, the brain doesn't know the difference whether you're taking just a party or you're taking for real pain. But you know, one of the predictors of addiction is also early use. The earlier somebody begins to start using, we know the brain isn't fully developed until the early 20s, and so that vulnerable brain when you're an adolescent is far more likely to be affected by these medications. And that's why, you know, one of the prevention efforts we have is to talk with parents and grandparents about their children if they're having dental surgery or they've had a sports injury, to talk with their physician about non-opioid alternatives to pain relief. There's a lot of good ones out there, so you don't have to just immediately go to something that strong.
So take your medical care into your own hands, basically.
And have a discussion with your physician. I think almost every doctor is willing to have those kind of discussions with their patients. So if parents are concerned and just say, is there something else? You know, that doesn't mean we don't need to take them, but we need to just question it, and then if we do take it the lowest dose for the shortest amount of time when that brain is still undeveloped.
Well, let's talk about the doctors. Of course, we've seen a lot of doctors in our area, a couple in our area who've been arrested for overprescribing. We've seen them in other cities and other states for overprescribing. The list goes on and on and on. Is that changing the way that doctors prescribe pain medicine?
It has, and as of right now, there's a limit on the amount of anti-opioid that we can prescribe in morphine units. And it's controlled tightly by the Prescription Drug Monitoring Program as well as Medicare and the Joint Commission. And if you exceed those, you put your license in jeopardy.
And then they don't work forever?
That's correct.
So you got to be very careful too on what are some of the alternatives that they're giving?
Tylenol and nonsteroidal anti-inflammatory medications similar to ibuprofen, Motrin, Advil, Aleve, Naproxen, all of those work. The NSAIDs, as they're called, calm down the inflammatory response around a blunt trauma to the point that you can actually get pain relief from them. And acetaminophen, which is Tylenol, works very nicely. And there are now, if you're in the hospital related to an injury that requires pain medication, IV Tylenol is now available as an alternative.
All right, now Alabama, according to our count, has about 7 inpatient rehab facilities and about 20 methadone clinics statewide. Do you think that's enough? I know, Brian, you've got clinics all over the place. Is that enough to handle the opioid epidemic? We absolutely need more. We need more resources to get people into treatment. We need a concerted effort, you know, on our government. It took a lot to get here, so it's going to take a lot to get out of it. We know just in the state of Alabama, with recent numbers released from the DEA, that over 1 billion prescription pills were prescribed in the state of Alabama between 2006 and 2012, over a million of them right here in Mobile. So when you have a crisis that has exploded that much, then you need to match it with the sense of urgency to end it. Wow. Let's talk about your facility that you've started. Tell us about that.
I have an intensive, strict and structured sober living facility. So I'm not treatment. I'm a step after treatment where I teach these girls how to become sober, responsible, productive members of society, to rebuild their life. And my main goal is to get them a life that they love so much, they're not willing to go back. It's so hard. I say all the time, I'm sober today by the grace of God and the company that I keep. Because I have to teach these girls that they need to build a tribe among them and stick together. I have girls right now in school, they go to college. They are working to get great careers. My girls are such hard workers. They want, after being so low for so long, they want to succeed. They want to do well. And they just need someone to love them and guide them and show them the way. I'm very affordable, $400 admission fee, and then they pay weekly when they start working. How did you break your addiction? I was given a little kickstart by Baldwin County justice system in 2012. I was sent to Anniston and told that I better get better, and if I didn't, I would do some time in jail. And so I spent 18 months in residential sober living, and I rebuilt my whole life. And I do not regret one day of it. It is the best thing I've ever done for myself. I needed to go sit in timeout for a long time, basically. That's where the addiction to pain pills took me. Was, you know, I remember laying in bed at 29 years old thinking, how has this turned into my life? How did I become this? I didn't talk to my family and to God as a little girl and say I want to grow up to be an opiate addict. And I just couldn't believe where my life had gone. And it took me a long time to learn how to rebuild it, separated from the life I had created through addiction. I had to be completely separated.
And we hear all the time, it's not just the patient who suffers, but the family who suffers, the family of those who are addicted. And I'm sure that all four of you have seen the consequence of those. I mean, you, when family comes into the emergency room and at the treatment center, and with you as well. Let's talk about that.
There's probably nothing more painful than a family that's addressing a loved one's addiction. You know, it's scary. Everybody in the family responds a little bit differently. You know, some people get angry, some people get afraid, some people are sad, some people want to get away from it. And so to bring the whole family together, to get them kind of all in the same place, to be able to, you know, to help their loved one is very important. And then just to know where all the resources are, you know, to know what's available in the community. You know, if their loved one needs detox, and then if they need treatment, inpatient or outpatient. You know, every situation's a little bit different, you know, depending on the person, the individual. And then the extended, you know, the most important thing I think is the long-term sober living, because many people can go through addiction treatment programs successfully and then they get back out and they relapse. So it's not as much about getting sober as it is staying sober. So, and that takes time. You know, it takes time to build new habits, to learn new things, to love your life, to, you know, and so we've got these facilities now. We didn't have them for a long time. So, you know, I'm grateful, you know, that these programs are here now.
And so that's helping them. What about that family support, Brian? Is that just as important as the extended support that Virginia was talking about? I mean, does it all come together?
It is so important that everyone recognize that addiction is a family disease. It does not just affect the person who's addicted, it affects everyone around them. And we know Sinclair across the country has been working on raising awareness, and we've talked with your sister station WZTV on their series Addicted about that, about how it's a family disease. So everyone is affected, and everyone essentially needs support systems. You know, even the people who love someone who's battling an addiction.
Let's talk about your facility then, and exactly how it works. Explain to us how that works.
So generally what happens is when someone needs treatment, they're assessed, and we take a look at what's going on with them, how severe their addiction is, if they have co-occurring dual diagnosis, another mental health issue accompanying with the addiction, and what type of level of care they're going to need. We assess them, and then we work on getting them in, and whether it's with one of our facilities, or we have a vast network of people that we work with to try to get them somewhere, you know, hopefully as soon as possible, because there's a short window of when someone is ready and willing to get help, and you have to take advantage of that and get them in there.
Now, you've helped so many addicts with your facility. Let's hear from two men who lived seemingly normal lives before that addiction took place.
My name is Jonathan. I'm a husband, a father, a writer, the son of an alcoholic, a recovering alcoholic, and in July of 2011, I overdosed on prescription sleeping pills.
I come from a great family. I was a top-tier athlete. I was a part of a fraternity in college. Graduated with a marketing degree, great friends, and yet 5.5 years ago, I overdosed on heroin and Xanax.
Well, now let's take a look at some statistics real quick, and these statistics are going to actually make you sit up and take notice. 68% of all overdose deaths in this country involve an opioid. That's about 130 Americans die every day, again, from the opioid overdose. We did the math again. That means 5 people will die just during the course of this discussion. We've said that at the beginning. We're going to say that again now. I mean, that's deep, because you think about it. When we did this town hall a couple years ago, 91 Americans died every day from overdose, compared to 130 now. So it's not, I mean, we're talking about it, we're discussing it, but it seems like the numbers are growing. They're not decreasing. What do you think the problem is? How can we decrease those numbers? Do we have an answer for that?
It's prescription stuff, the way that the physicians here in Mobile that were prescribing too much and defrauding the public in the use of the oxycodone and hydrocodone, and the fact that they're now serving time for having written prescriptions that would have covered everybody in the county at one point, and removing that as a source to make sure that the people who get prescriptions take them correctly, and that they then use alternative medications like Tylenol or the NSAIDs to control their discomfort, instead of just relying on narcotics for the relief of their pain, and make them realize that if somebody has a broken bone, there's no amount of pain medicine I can give you that's going to stop the pain completely. It can make you not care about the pain, but it's not going to make the source go away. The source is there, and you're going to have issues with it for a finite period of time. And having the person understand that and take other medications to try and keep them from taking opiates and becoming addicted to them.
Now, you said something earlier, even before we started this panel, that was pretty interesting to me, that you were saying that it seems to be coming down the 65 corridor, the amount of people who are addicted to opioids.
Every summer, our state emergency medicine chapter here in Alabama has a meeting in Sandestin that is a group of programs from the other states here in the Southeast. The other chapters come, and we call it the Southeast Chapters Meeting, or the SEC, so similar to the Southeastern Conference. And at that meeting, the president of the Kentucky chapter has spoken over the last 4 years regarding the incidence of opiate overdoses and problem in eastern Kentucky, western West Virginia, and Ohio, and how that has trickled south down I-65 through Tennessee and now into North Alabama. And if you look at the use of Narcan, which is the drug we use to reverse an overdose and wake them up, the 2 counties that have the biggest problems in the state are Madison and Jefferson. If you look at the use of Narcan statewide, excluding those 2 counties, it's 7 to 8 uses per 10,000 population for all the other 65 counties. Those 2 counties are roughly 18.7 uses per 10,000 population. They sit totally different than the rest of the state.
So even though our numbers are growing down here in South Alabama, it's still not as high as North Alabama.
I can't give you the breakdown on Narcan use from anything. The numbers I just gave are for 2018, and that's hard data that comes from the state Office of EMS, and is all the uses of Narcan by the EMS systems across the entire state.
The Narcan, it's saving lives. It's waking people up. But what's interesting here is we were talking again before the show starts that it also makes you angry. And tell me a little bit about that. Haley and Brian, tell us about that.
I have not experienced it myself, but I work with a lot of people who have. And when you're in the state of IV drug use, and mostly that's what this opiate stuff is, to the extent of when you need Narcan, you don't really want to wake up. You're okay if you die. Your life is in such a bad spot. When you're injected with Narcan, you're in instant withdrawal. So they wake up fighting mad, and they almost believe they're not worth saving at that time.
Well, mine was not from an addiction. Mine was from a suicide attempt. And when I was revived, it was just this strong jolt and an awakening. And at that mindset, at the mindset that I was in at that point, I wanted to die. I did not want help. And then when I was revived, I was like, why is this happening? Like, why, you know, what's going on? And I think, you know, you brought up an interesting point. You all have done a really good job tonight, especially, of having the main 4 approaches of things that everybody can do to help solve this crisis. We have the Drug Education Council that is out raising awareness and you know, promoting the use of naloxone, getting it in the hands of people with prescription take-backs. And you have you at the hospital treating people medically, which is the first line of defense against the opioid epidemic, is keeping people alive. And then they come into addiction campuses, places like addiction campuses, where they learn mindfulness, dialectical behavioral therapy, why they're feeling these things, why they want to use, and then the aftercare at the landing, where they learn, you know, rehab is the beginning. That's where they get the tools, and then you have to have that, they have to get plugged in afterwards into resources like that so that they can maintain their sobriety.
So the support is very important.
Yes.
It's very, I mean, just like you hear like an alcoholic or any other addiction, you've got to have that support system.
Yes.
Now, let's talk about the people who really are out there who actually need these prescriptions. And because the way that they're prescribed has been changed, that they are not able to get them because of that crackdown across the state, across the country. We're going to hear from one of them and how this has affected them.
Honestly, I actually contemplated ending my life at one time. I have a young child that, you know, that luckily stopped me from going through with it. But it's the fact that you don't get any support that you're supposed to get from the VA. You know, you're told that they're going to take care of you when you get out of the military, but when you get out of the military, you come up against roadblocks like this.
So how do we find the balance of giving prescriptions to those who really need it, compared, you know, and you say, okay, this person's not addicted, this person really needs a pain medication.
Some patients have chronic pain related to neck or back issues that require it on an ongoing basis. You can even have patients who've had amputations who have phantom pain that again requires pain medication. And for those, subcutaneous IV pumps are the best answer to give them something that is controlled dosage throughout the day. They're not taking tablets. And if you're using those, they need to be continued on an ongoing basis. When the 2 physicians here in Mobile, when their office was taken over by the FBI and got all the resources that were there, they took all the records of the patients who were selling drugs or using them inappropriately, along with those of patients who had real issues. And over that weekend, over the entire city, all 4 ERs were inundated by patients whose pain pumps were now dry and couldn't get a refill. And so it can be a real issue. And now that we have addressed those over time within the Medical Society of Mobile County, to have precautions to make sure that those things won't happen again.
So that you'll know exactly who actually needs them.
Yes.
We're going to go to my co-anchor, Greg Peterson, who's standing in our newsroom. Greg has been taking in questions from our viewers through social media. Hey, Greg.
Yeah, a reminder to everybody out there, we are taking your questions live during the discussion. We've had a viewer who posted a question on our NBC 15 Facebook page. They want to remain anonymous, but they are asking, my loved one is battling an opioid addiction right now. It hurts me every day to see them slowly killing themselves. Can I check them into rehab? And if so, how much will something like that cost? And Kim, I know that your panel has a lot of experience in that and probably can answer that.
Okay. And he was asking for a family member, can someone be checked into rehab? I mean, what's the process and how much does it cost? Is it expensive? And that's what a lot of people think. It's expensive. It's something they can't afford.
They can call 1-888-614-2251. We have people standing by. We also have on our website, addictioncampuses.com, free confidential chat where we can talk to them. Look, we've had people, depending on the level of care, it varies. The price does vary, number one, from campus to campus, but also on the level of care that's needed for that person. Someone who has had a significant amount of trauma in their life might require more one-on-one personalized care than someone who maybe just recently developed an addiction and is looking to get help. So the main thing that we tell everyone, call us. We will work to get you in somewhere and we will not stop until we do that. We will do everything in our power to do that.
And you see a lot of people that come in as well looking for help.
Absolutely, and we're more than willing to work with families to find the appropriate place for their loved one. And also, even if we can't get the loved one into treatment right away, there's a lot that we can do to help the family. And you know, there's a lot of evidence that shows that when a family reaches out for help, the addicted person has an 80% better chance of getting into treatment eventually. So, you know, I really encourage the family members to reach out and get help for themselves, because there's, you know, as he said earlier, it is a family disease. It affects everybody in the family. So we're more than willing to sit down with families, no cost, to you know, explore their options based on, you know, it's all individual based on what drug they're taking, how long they've been taking it, you know, what resources are available, what they've tried before. You know, there's a lot of questions that need to be answered.
And we talk about the entire family, but there's so many babies nowadays who are born addicted to opioid too. There's special care that they give some of these babies. Let's take a look at some of these babies that we've talked about who are born addicted to opioids. It is a heartbreaking reality in this nation's opioid epidemic. Drugabuse.gov says a baby is born suffering from an opioid withdrawal every 15 minutes. That means about 96 babies will be born addicted today alone. The problem has increased nearly 5-fold in just the past decade.
Infants that are born when they've been exposed in utero to drugs such as opiates will unfortunately develop some of the same effects that anybody would.
The babies suffering from neonatal abstinence syndrome scream at the top of their lungs, vomit and sweat uncontrollably, and sometimes even have seizures.
So they're born essentially addicted to the medication, to the opiate, and then they can go through withdrawal.
It's such a big problem. Doctors and nurses caring for these sick babies decided to take action. Hospitals across the country, including USA Children's and Women's Hospital here in Mobile, have a program where volunteers can cuddle babies to help them through the withdrawal process. All right, let's talk about some of these babies, and hopefully, I know Dr. McMahon, you're in the ER, but what are some things that doctors do to help babies who are addicted to opioids?
It's simply supporting. There are a few medications that can block some of the receptor sites, but we have to be very careful with them in the neonates. A drug called clonidine, which is an antihypertensive medication, can block the receptor sites of somebody who's going through withdrawal. But in that size for the neonates, they use different medications, and they use supportive care to treat the other parts of the withdrawals.
Now, I know opioid addiction is still so fairly new. Do we know, has anybody known the outcome of how these kids turn out? I know some of them are still so young. We don't have the statistics on that right now. Well, what can we do to help pregnant women who are addicted to opioid? What can be done?
I think one of the most important things that we can do is destigmatize a pregnant woman who needs help. You know, I had a friend who gave birth to a baby that was addicted, and she said, I didn't want people to think that I was a bad mom. I didn't want to reach out because I didn't want people to think that, and I thought maybe I can control this on my own. And we see that time and time again, and that's why at Addiction Campuses, we've developed programs specifically for pregnant women, because, you know, for so long, people who, you know, ran rehabs didn't want to take on that type of liability, because there's a lot of liability, and you're treating not just one person, but two, essentially. Yeah. And so we've developed some really great programs at the Bluffs in Ohio that can help women with that.
You'd be amazed. I mean, when you said that, when I was doing the story on babies addicted, we tried to get a mother to talk to us. None of them wanted to talk because people didn't want people to think they were bad parents or they were a bad mother. And I mean,
right. And you know,
they don't get addicted on purpose.
Right. And you know, we need to not forget the grandparents too, because so many of these babies are now being raised by grandparents who are in their retirement years, not really planning to take, you know, they didn't plan in their retirement to take on the raising of a child. And, you know, because of their the baby's parents being either addicted or overdosing, you know, they're not able to parent. So, you know, the community needs to provide a lot of support for these grandparents that are raising the children too.
That is so true, and we see that so many times, not just with opioids, but other addictions as well. Now, Haley, you know, when you came off, when you no longer an addict, I guess that's the way that we want to put it, and your work is so admirable, what made you decide you wanted to dedicate your life to helping other women?
When you get sober and you go through everything, you get so passionate about it. And I don't know how it happened, but I had met my husband and he said, let's open a sober living. I was like, me? I can't do that, no. He's like, yeah, you can, let's do it. So we did it, and I haven't stopped doing it since, and it's just continually worked. The girls listen to me. They know I've been exactly where they've been. I'm just like them. So it's so much easier when you have someone showing you the way that's been there.
And that makes all the difference in the world too, when you can talk to someone who's walked in your shoes. And I mean, so more people can trust you that way.
Yes.
And do you find that more yourself, Virginia, people are saying, hey, is there somewhere I can go where people have gone through the same that I've gone through?
Right. Right. Yeah, and you know, for recovery, you know, one of the most powerful things are the 12-step programs too, which are, you know, totally free, and that is where you get the support of other people who have been where you've been.
All right. Now, the Drug Education Council has such an important role that they play. Let's talk about all that work that you do.
Okay. We provide prevention programs throughout the community, a lot in the schools, but out in community groups. We also work with families doing, helping, you know, intervene and get their loved one into treatment. And then we provide help for the recovering community. We provide a lot of support for the recovering community. You know, we want them to get together, to advocate together. You know, we've got a lot of advocacy groups, and, you know, because we want to reduce the barriers for getting into treatment. You know, one of the biggest barriers is the stigma. So I think if we can speak up as a voice, we can talk about, you know, this can happen to anybody. It's in most families. And, you know, we can talk about it openly, then we're more likely to be able to get people the help that they need.
You talk about going into schools and talking to people about opioid crisis, of course, and Haley, you were 14. Are we seeing younger kids that are becoming addicted to opioids?
Yes, you know, it's actually been described as a pediatric illness. You know, just in my career, the age has dropped and dropped and dropped to the people presenting for treatment. You know, so today, you know, it really is such a young group of people that are coming into treatment for the first time. So, you know, we really need to provide support for them, for their families. You know, we need to make sure families can talk about it, that they're not embarrassed, and then we've got to make sure that we've got the resources there to help them. So, you know, it's a complex issue, and we've got a lot of good folks in the community working on this.
Oh, how young have you seen a patient come through? Let's start with you first, Dr. McMahon.
Youngest one I've seen, probably 10 or 11, accidental overdose pills. Have had some children maybe a little bit younger than that, but they took a pill that belonged to the parents and came in lethargic, and the parent or babysitter is the one that found them that way. And they all have pinpoint pupils, and so we give them Narcan to reverse the symptoms. And Narcan's readily available now even to the public, so that not just EMS providers, the police, fire rescue units, it's openly available to virtually everybody in the public now.
You think about that, so young. What about, Brian, young as far as coming in to your treatment center? What's the youngest you've maybe seen?
Well, we're an adult facility, so the youngest that we've treated has been 17. The youngest person that I've talked to who got addicted at a certain age was 9 years old.
Oh, wow. Well, the opioid crisis, well, let's first go to the newsroom where my co-anchor is standing by, first of all, to get another social media question. Greg?
Kim, we're getting a bunch of questions on our NBC 15 Facebook page. This one from someone who has been in the medical field for a couple of decades. Ken says, what about the patients who have genuine need for prescribed pain meds? They get the RX, the prescription, the pharmacy fills only a fraction of those meds. The DEA instituted a system years ago to prevent doctor shopping. Is it working? He says no.
All right, what do you think?
From an emergency medicine standpoint, I can say that there are many, many patients who have chronic issues related to pain. One large population that we have within the city are sickle cell patients who will become, we know they will become addicted, and they will sometimes abuse that in order to sell drugs to make money. And it's simply a matter of trying to prescribe limits of the medications themselves for people who are addicted. Because of the prescription drug monitoring program here within the state, as well as in surrounding states of Mississippi and Florida, all prescriptions are monitored, and if you start exceeding the dose that you're supposed to be getting, we know it, because those prescriptions we check it online, and that's how we know who's getting what. And it's a way of limiting that to begin with.
And you know, Kim, in this crisis, we've got really two chronic conditions that both need treatment. One is addiction, and the other one is pain. Yeah. And so, you know, I would really like to encourage the medical community to continue to discuss that, because we really, you know, we don't need to treat one at the expense of the other. So, you know, and I think most medical professionals and healthcare providers are aware of that. And so I think more discussion about where is that line, how to treat somebody appropriately for their pain, and then also protect the majority of the community from developing addiction, because we know some people are more likely to develop addiction. We know that some people will, you know, but I think that needs to be a discussion about, you know, treating both of those conditions within the population.
On the horizon related to sickle cell, there is genetic altering with bone marrow transplants with genetically altered genes to erase the sickle cell abnormality that's genetic. And the people that have had this done so far is 100% back to normal. They do not have sickle cell disease.
That is cool.
Yeah, yes. And we actually did a story on a man here who was able to do that treatment and no longer has sickle cell. That's after correct. Suffering for years. Wow. And you're saying there's so many children and people who have sickle cell disease. Yes. And you were saying that they will get addicted?
They will, and it's because they will have a pain crisis after pain crisis to the point where they're taking medications all the time, just because the biggest thing they can do to try and prevent it is to stay hydrated. But kids don't pay attention to that in general, even if they have sickle cell, and that's unfortunate. I mean, we live in a place where hydration is very much needed because of our humidity in the summer times. You have to maintain a certain hydration rate, or you're going to end up seeing us for a different reason in the ER.
Wow. I just wanted to say to this person who wrote in, I just want to make sure that it's known, nobody on this stage, and I don't know of a recovery advocate that is trying to deliberately take medication out of the hands of someone who desperately needs it. Mm-hmm. Nobody wants that. Nobody wants someone who is in pain to continue to be in pain. What we are advocating for and speaking out for is for people to follow best practices that were released by the CDC, people to check the prescription monitoring systems that are in place, for people to not use opioids as a first line of defense for chronic pain, maybe to look at other alternative therapies, to have that discussion with people so that it's not the immediate go-to, because that is kind of how people get a hold of it and spin out of control. We're in a health crisis, and so some adjustments need to be made as far as what discussions people are having with their doctors. This crisis, it's cost Americans, according to the White House Council of Economic Advisors, it costs $2.5 trillion to the U.S. in the past few years, $686 billion just last year. So these are all things that are affecting every facet of government and every facet of our lives. And so we have to make some adjustments and make sure that we're following best practices.
People are dying.
Yes. If the public is, you said earlier, this is a silent addiction, and it's totally different than alcohol that you can smell on someone's breath. And it's the family or coworkers who may know what the person's doing that is addicted that need to rally around to get them to seek care.
We talked about the government. Do you have something else you want to say?
Yeah, when I was in opiate addiction, I didn't know about recovery. I didn't know that I could live every day and not be in pain. But what a lot of people don't understand is when you're taking this medication every day and say you go without it a day, you are in severe pain. your body is screaming that you have to have this medicine. So I didn't know that I just needed to go through a medical detox, get through the other side of that, and my body stopped hurting. That's not the case for everybody, but I'm trying to help people understand when you're taking the pills, your body will hurt if you don't have the pills.
Because it's so used to taking them. It wants them.
Well, it's not just a psychological addiction, it is a physical addiction. And the body itself is requiring and demanding that you get it.
So it just kind of adjusts itself to say, I'm going to be in pain. I'm in pain.
No, they're not in pain if they take it, or take enough. I mean, for the people who use IV heroin, they require higher and higher doses because if they plateau, then and keep on taking the same amount, they will not get the high that they can get with heroin, and that's what leads to further issues. And heroin that's then laced with fentanyl is where you get most of the deaths from IV drug use.
Well, the opioid crisis across this country is getting the attention of everyone, including our leaders in Washington. President Donald Trump and First Lady Melania Trump, they unveiled an initiative to stop opioid abuse last year. Here's a look at the White House's plan of action. Part 1 is reducing the demand and overprescription of painkillers. Part 2 is cutting down on the supply of illicit drugs by cracking down on drug supply chains. Part 3 is helping addicts with evidence-based treatment and recovery support services. So, I mean, you're right when you say the government is getting involved with it. They're getting involved.
Absolutely.
So
Yes.
this is costing us a ton of money.
Absolutely, and I think one of the things that President Trump did that has been a good idea is the STOP Act. You know, when he signed that into law, that puts more screening systems into place at the United States Postal Service to screen for incoming fentanyl from Mexico and China. We get a lot of people, you know, there's a lot of talk that this administration does about what's coming in from over the border in Mexico, but we don't talk about what's coming in from the factories in China that are coming in through the dark net, which is an underground sort of website where you can buy anything from guns to drugs to people. And it's, you know, unfortunately, you know, now we live in a world where your drug dealer isn't just down the street, your drug dealer is on your laptop, you know, in your office or in your living room. And people are ordering it and having it sent straight to their home. So that is going to help cut down on some of the fentanyl that's coming in. And fentanyl is the most, I believe, correct me if I'm wrong, doctor, the most powerful opioid that's out there being distributed.
Absolutely, absolutely.
And I mean, that's kind of scary, though, to think about you're ordering something from a different country that's not regulated by our FDA. I mean, do you even know what you're getting?
No.
It's no different than the chemicals that go into the non-regulated vaping drugs.
Really? So that's a whole other subject you can touch on right there. Because, I mean, do you think, and you're right, we've heard about it all the time, okay, let's stop these drugs coming in from Mexico. It's the first time we're hearing a lot about coming in from China, but are they more at risk from dying from those drugs that they're ordering in compared to the ones here in our country that they're being prescribed at the doctor's office?
I would say both.
I'd say both would be, both are dangerous, yes.
Both are dangerous, so it's not one that's stronger than the other.
No.
Well, fentanyl is stronger than oxycodone. There's no question about that. It's also stronger than morphine. And in morphine equivalents, it's 10 plus times greater potential for relieving pain, but also for putting somebody in respiratory arrest and subsequently cardiac arrest.
We tell everyone, even when you're prescribed a drug and you don't obtain it illicitly and you have it in your home, people don't think about it, but it can kill you. It is a weapon. It can be, and you need to treat it like a loaded weapon. We tell people, treat it like a loaded gun in your home. Lock it up. Count them. Count how many pills you have. People who come over to your house and addicted, they know exactly where to look to find your pills. Keep them locked up, count and make sure that none are missing, and dispose of them properly. Take them to a prescription drop-off location or take them to a prescription drug take-back day.
That's my next question. We talk about it being a silent addiction. How do you know if someone's addicted to opioids? I mean, are there signs? How can you tell? There's a problem.
They may disappear at times in the instance of in the medical profession, if you have nurses who are using IV drugs for their own addiction, they may go away for a period of time, and you have to start suspecting that they may be using them because the patients may not get the relief from their the pain medication that was ordered. And that's when you start suspecting that they may be tapping into the supply. And there's safeguards in place to try and check on that now, because it used to be that just bottles of the drugs were on the shelf 20 some odd years ago. Now they have machines that have to use your thumbprint or fingerprint to put in. They know who's putting the order in and who withdraws the medications out of the machine, because it's only that, and it's that person giving the medications.
Now that's at the doctor's office in the hospital, but what about for just a common person like me? I mean, how can you tell if you have children or a family member who's addicted? Are there signs?
Well, there are some signs. You know, depending on your relationship with the person, you know, if there's money missing, if it's your spouse or your child and there's a lot of money that you have no idea where it went, you know, that's one thing. Change in personality, change in friends. You know, there's a lot of signs and symptoms. There's, with adolescents, you have to be careful because some adolescent behavior that's normal looks kind of like drug use. So, you know, you have to be careful with that. But I think it's just being aware, knowing about these drugs, knowing what, you know, your loved ones are taking, and asking them about it.
The other part of it is if they're getting close to a time where they have to have the drug and they're starting to withdraw, they'll start to have some of the symptoms of withdrawal where they'll be on edge and they'll snap back at you for no apparent reason and start sweating more profusely, or to the point where you can notice it in a situation where you wouldn't expect somebody to be sweating.
Now, Haley, you were saying that the sign that you started getting into trouble. And
yeah, but
that's what made your family take notice?
Yeah, well, it's very expensive to be an opiate addict today because you're not getting them, your prescription isn't carrying you through if you've crossed the line into severe opiate addiction, so it gets very expensive. And so, of course, if you're not able to work because you're an addict, which a lot of addicts lose their job and seem to not even care, it's just like a depression sets in, and all of a sudden your personality completely shifts, and things you used to care about you don't care about anymore, and all of a sudden you're stealing from your parents, from people that are close to you, from your grandparents. I have so many girls who have an immense amount of shame because they've stolen from their dying grandparents' deathbed the medication they needed for cancer.
Interesting. All right, we're going to go back to our newsroom real quick to my co-anchor, Greg Peterson, with some more questions from our viewers from social media. Greg?
Yeah, we want to thank all the folks who have taken part and joined the conversation through our social media platforms, including our NBC 15 Facebook page. And we've had a couple of folks comment about the role alcohol can play as a gateway substance. Can you speak to the role alcohol abuse can play in opioid addiction, Kim?
All right, he was asking, you heard the question, what kind of role can alcohol play in addictions to opioid?
Combination, if the person drinks on a regular basis from teenage years on, they're more likely to have issues with addiction to alcohol, but the combination of alcohol and any opioid increases the possibility of an overdose, period. I mean, that's a known fact, that alcohol with any opiate is a potentially lethal dose.
So do not drink when you're taking opioids.
That is correct.
But if somebody's addicted and they're wanting it, are they making sense? Are they making wise choices to say, I'm not going to drink?
No.
No.
And it could also lower your inhibitions, where you're more likely to try something like that. And I've talked to so many mothers, and one of the reasons why I get up every day is because of the mothers of people who have lost, who we have lost to this crisis through overdose. And one of the things that they have told me is they'll come up and say, you know, my son tried it for the first time, tried heroin for the first time and was drinking or whatever, and they're gone. It doesn't necessarily mean somebody who's intending to try it. Some people get marijuana that is laced with fentanyl. Anything that you buy off the street, it's not regulated. You don't know what's in it. It could be anything and it could kill you dead.
Absolutely. And it's not just alcohol and opioids. It's a class of drugs called benzodiazepines, which are anti-anxiety drugs that a lot of people take. You mix those with an opiate or those with alcohol, you have a lethal combination again.
So it's surely going to kill you.
That's correct.
I mean, it's serious here. When you're talking about the people who are dying and the addiction and it's growing, and the younger people, we're talking about their brain's not fully developed yet, so that makes them more likely to become addicts.
Right. We know that 90% of addiction develops during the teen years, during the adolescent years. So we know that the longer you can delay the onset of drinking or using any drug, the less likely you are to have any kind of an alcohol or drug problem later on. But you know, one of the good news in this is even though the overdose deaths we haven't started seeing those go down quite yet. We have seen prescribing go down, and but we've still got a lot of people addicted out there that need treatment. So I think we're kind of stopping some of the new people coming onto that scene, but we really need to provide a lot of services for those people currently addicted, and then really step up our prevention efforts and make sure that our young people aren't getting addicted at 9 and 10 and 11. You know, there are some prevention strategies that are very effective, and you know, we need the community and parents and grandparents and educators to embrace those and talk to their children.
Now, the Drug Education Council, then if somebody has a problem, they can call you and you refer them out to other places as well?
Right. I can connect them with the resources in the community or throughout the state or southeast, you know, if the family needs help. But we can also talk to the family about trying to keep other family members from developing addiction.
And that can happen. I talked to a family member who lost their son to addiction. He was a baseball player, and we did that story and we talked to the family, and then they realized later on that they had another son who was addicted and didn't even know it until after he saw his brother lose his life. And he said, I've got to stop this.
Right.
So do you think they just pass the drugs on, or?
You know, there's a lot of different ways it can happen. You know, both of the young men could have started using early. The family could have a genetic predisposition. There could be some trauma involved. You know, there's all kinds of things that contribute to somebody becoming addicted. And sometimes, you know, siblings have kind of that survivor guilt. You know, we focus a lot on the parents who have lost children, but you know, these siblings have lost, you know, their brother and sister. So we really need to provide a lot of help for families when they've lost a loved one to addiction.
All right, we want to thank you. Our time is wrapping up here. Virginia Guy, Brian Sullivan, Haley Beeson, Dr. McMahon. I mean, you've got a wealth of knowledge up here, and this is a conversation that we need to continue, because opioid is serious. You've got some helplines right here, the numbers on your screen that you can call if you are addicted yourself, or if you know someone is addicted. We need to slow down those numbers. We need to stop the numbers. We don't want anyone else to become a statistic in our area, so we're going to do what we can, and we're going to continue this fight of stopping this opioid crisis. Thank you for joining us so much. I'm Kim Anderson. Until our next town hall meeting.